Hello and welcome. Good morning to those of you who are outside the East Coast. And for those of you on the East Coast joining us, good afternoon and welcome to our Medicaid 101 webinar. My name is Melissa Williams, and I am the Director of Grassroots Advocacy and Community Partnerships here at National Patient Advocate Foundation. I think I see many of you are already introducing yourselves in the chat. Please continue to do that. We want to know where you're joining from, your name, and you're also welcome to just drop what you hope to learn today. As indicated by our title, we're talking all things Medicaid today, but at a very basic and broad level. The reason we are doing this webinar is because actually Anita and I had a conversation like a month or two ago following the action alert that many of you took around protecting Medicaid. And we realized that, there are just some things about Medicaid that's just super confusing. And maybe there are people who just might need a refresher, or they just don't really know all the details. And so we're gonna not go into every single little bit about Medicaid because there are others out there who know way more about this topic than we do. But what we're going to talk about is why we care, why you think you all should care, and what you can do to educate your communities about making sure that they care about Medicaid because it does impact all of us. And so I know this may be the first webinar for a lot of you that we are hosting. So I just want to extend my gratitude and welcome. And we hope this is not the last meeting you join. So with that, I am going to turn it over now to my colleague, Anita Reynolds, and I'm gonna let her kind of break down what we want you all to take away and learn more about Medicaid. So Anita, go ahead.
Thank you, Melissa, and good afternoon and good morning, everyone. And once again, thank you so much for joining us today. I am Anita Reynolds, the Manager of Grassroots Advocacy and Community Partnerships with the National Patient Advocate Foundation. And like Melissa mentioned, this started from the conversation. We're doing these action alerts and also working in my previous roles in the organization, realize that so many don't know that they are on Medicaid because of what is called on their state. They may not realize that services vary state to state, or if they move to a different state, that their coverage might be a little different. And so if we're talking about protecting Medicaid, we need to understand what exactly are we protecting, and understanding it is the first step. So especially as we're going out and looking and understanding these potential budget cuts that threaten the program that supports millions of people, we wanted to have, like Melissa said, a very broad 101 of who's covered, what does Medicaid do, and how do we understand it. So first, we want to take a moment, just recognize the sheer scale of what Medicaid covers and the impact it does. There's nearly 80 million people depend on Medicaid and accessing the essential care it covers. It provides everything from basic healthcare to long-term care. And our goal today is to understand just how critical this program is and why it's so important to advocate towards it. So just think as we go through these slides and I continue on, just remember that number, 80 million people in this country. Today, we'll focus on three key areas. First, I'll explain how Medicaid works, who it helps, and what it covers. Then we'll go into Medicaid's role in making the healthcare work for all of us. And then we'll wrap up by sharing 3 action steps you can take in your community to help protect it. Let's take a closer look at what Medicaid is. Medicaid is actually the largest source of healthcare coverage in the United States. It helps those that may not have coverage. It offers a full range of comprehensive care from basic checkups to long-term care, but each state manages and administers a program and has the ability to tailor it to their community needs. And it's actually a federal and state funded program, and where the federal government sets the basic rules and guidelines, but the state administers it. And what this balance allows, it allows that both the national consistency, but also the local flexibility. Now, while Medicaid is a cornerstone of the safety net, there's also a few other federal safety net insurance programs that are designed to help individuals access the healthcare they need. We have Medicare, which provides healthcare coverage for individuals age 65 and older, and for people with certain disabilities, regardless of their income. Then we have CHIP, which is a children's health insurance program. And what CHIP provides is coverage for children and families who don't qualify for Medicaid financially, but also don't make enough to afford their own private health insurance. And then there's a program through the health insurance marketplace that actually provides financial assistance to help pay their insurance premiums. And together, these programs, along with Medicaid, make the important safety net and providing health coverage across different age groups and income levels. Now we're going to go into who Medicaid actually covers. But first, we're going to clear up our first myth. And that myth is that Medicaid is for poor people. And the truth is that Medicaid is available to a much broader group of people than many realize. Yes, it is income-based, but that doesn't mean it's just for people who are unemployed. In fact, many people who qualify for Medicaid are employed, sometimes full-time, but still can't afford the high cost of health insurance, or even if their employer does provide health insurance. So when you think about your community, look at those small businesses that may not be able to provide health insurance for their employees. Or think about the caretakers taking care of your children at daycare. Those are some of the real people who are on Medicaid as well. Who Medicaid really covers, it's a wide range of people that includes pregnant women, children, older adults, and people with disabilities, and even the caretakers. So as you can see here, Medicaid is a lot more inclusive than many realize. It's broad, and it's designed specifically to help people from all walks of life get the care they need. And on this chart, it really shows the breakdown of Medicaid in the enrollment groups. So children make up the largest share, highlighting Medicaid's role covering low-income families. Adults are also included with the expansion. And then people with disabilities and seniors actually make the smaller portion. However, they often require more complex care. So now I'm going to share why Medicaid matters, and it matters to me, and it matters to so many in our community. So Medicaid covers nearly half of all the children with special healthcare needs in the country. And I wanted to share this first story of with a family, and this is little Adrian. And at just 6 months old, Adrian had experienced what's called non-accidental trauma. It's also known as shaken baby syndrome. Now, Adrian needs a trach and also a feeding tube to survive. His mother is actually active duty in the Air Force, so they have TRICARE, and his father had to stop working to help care for their son. Many people assume that military insurance like TRICARE covers everything, but the reality is it doesn't. So it doesn't cover some of the essential therapies, the home nursing care, and even specialized equipment that Adrian needs. So that's where Medicaid stepped in, and it makes sure that Adrian gets the care he needs to heal and grow, but also supporting his families. And it's families like Adrian that Medicaid is necessary, and it's not just a safety net, it truly is a lifeline for so many. Now let's clear up another myth. Medicaid is a lesser form of health insurance, and that's also far from the truth. Medicaid covers so much more than basic healthcare needs. It even covers more than some private insurance in many instances. It covers a long-term care, home and community-based services, and even supports people with disabilities and, like Adrian, children with complex medical needs. So instead of thinking that Medicaid is less than, we should really start looking at it and recognize it truly what it is. It's comprehensive insurance coverage. So the core benefits and exactly what it covers is all states are required to provide the same core benefits. Provides a comprehensive from doctor's visits to even transportation to and from treatment. It's designed to ensure that people not only have the access, but are able to stay healthy. It's a full spectrum care. There's also lists of optional benefits that states can choose to include. And these benefits include services like dental care, vision services, and even physical therapy. So depending on where you live, Medicaid coverage might look a little different. You're all going to get the core benefits, but some may have a little more as well. So it's important to know what's available in your state and to advocate for the services your community needs. So I encourage you to look at your state's Medicaid websites and see what services are provided and also what providers accept Medicaid. Our next myth is that Medicare covers long-term care. And in reality, Medicare does not cover most long-term care needs. It may cover short-term stays at like a skilled nursing facility after a hospital stay. However, when you look at long-term care, unfortunately, it doesn't. So when we talk about Medicaid's role, it's important to recognize how critical it is for certain populations. 5 out of every 8 nursing home residents depend on Medicaid for their care. And when it comes to long-term care overall, Medicaid covers 61% of the total spending in the United States. And it's the largest payer for long-term care services in the entire country. Our next story I want to share with you is actually Miss Debbie. So Miss Debbie retired, I believe it was the end of 2023, and shortly after retiring, her health began to decline. So it was actually unsafe for her to live in her home independently, and she needed a skilled nursing facility to help get the care she needed. Without Medicaid, Miss Debbie and her daughter Tracy wouldn't have been able to afford the level of support she needed that allows her to live safely and with dignity. So it's for older adults like Miss Debbie who qualify for both Medicare and Medicaid. It's known as dually eligible. Same as Adrian's family. They have TRICARE and Medicaid. So Medicaid helps cover critical services that Medicare alone doesn't provide. So our next myth is that Medicaid has the same name in every state. And that's not true, and that's what started this webinar with this conversation. Many don't even realize they have Medicaid because it's a different name in many states. For example, in California, it's Medi-Cal for both their Medicaid and their CHIP program. Whereas Tennessee, you can see it's called TennCare, but their CHIP program is called Cover Kids. And my personal favorite was Vermont. Dr. Dinosaur is far from CHIP or even Medicaid. So this is a good reminder to see like how flexible the states can be in managing their programs, but also able to understand that even the name changes. So we're going to talk about Medicaid expansion and why it matters. Medicaid expansion and the breakdown on how Medicaid is funded. When the Affordable Care Act, what it did, it gave states the option to expand Medicaid. It opened the door for millions of low-income adults, especially those without children or disabilities, to actually able to gain access to healthcare coverage that not only they can get, but also one that they could afford. Traditionally, Medicaid is funded in partnership between the federal government and the states. So the federal government must pay at least 50%. However, states with lower per capita income receive a much higher rate. That means the federal government pays a little more than the state provides at the 50. When it comes to the expansion, the federal government actually pays 90% of the cost, which made it easier for states to provide coverage to those low-income adults that weren't eligible before. But the challenge is that not all states expanded. As of today, all but 10 states have expanded Medicaid, so that means there's still millions of people that are falling through that coverage gap. Now, why do we care? Now, I know why I care, I know why NPF care, but why we should all care is at the core of NPF's mission is to make healthcare work for all of us. And Medicaid matters because it's not just a government program, it truly is a lifeline and ensures that people can get access to the care they need at the level we should all get the same level of care. I'm going to shift our focus to a few action items that we can do now in our community. The first one is connect with our community because real change happens with the conversation, very similar to how Melissa and I had this conversation and where we are today. We take what we learned today, let's use it to spark conversations, whether it's around your community meetings, texting a neighbor. We want our community to understand how Medicaid works, who it covers, and the impact it has in our community. Because remember, every conversation is a step forward in awareness and making just someone know that it affects them. They may not have Medicaid themselves, but it may affect the person who's taking their child at daycare. It could affect the person driving your children to school on the bus. It affects so many in our community. Another way to stay connected is to please follow, share, like, and support this movement, and to follow us on LinkedIn, on Blue Sky, and on Facebook if you haven't done so already. And also invite your friends, your coworkers, and your community to also join too. Because for every follow and share, it lets us know how far it reaches, but also it lets us understand that our mission and our message is expanding. And also we want the feedback from different people in every community. So if you can help us reach more people and strengthen our collective voice, it would be so helpful that if you can just share all of these resources, including this webinar. One of the most powerful ways we can advocate and to change is just simply by sharing our voices. And I say simply, but it's actually a big ask because when we speak, change listens. And real experiences, just like Miss Debbie and just like Adrian, show what Medicaid means to so many people in their everyday lives. It helps families stay healthy. It supports caregivers like Tracy know that her mother is safe and able to be healthy. And it makes a difference when people need it the most. So when we're asking you to speak up and share your story, know that we're asking like, how has Medicaid made a difference to you, your family, or even someone in your community? And that also doesn't stop there. We also encourage you to share this with your community if they have an experience with Medicaid. It may not be themselves personally, they might know someone as well who depends on it. So we made it easy where you can scan this QR code on the screen and you could just take a few moments on how you could share your story and what Medicaid means to you. And this is the last myth I'm going to debunk, and it's that I can't make a difference. Many people believe that they can't make a difference because Medicaid is a big issue, but it's actually not the truth. You can. Every voice matters here, especially when it comes to advocating for healthcare access. And we need to understand, it's something that I always say, is that advocacy is scary. It really is, but it doesn't have to be intimidating. It doesn't have to be loud or on a large scale. And it often starts with a simple conversation with a neighbor on why Medicaid matters. Each of these small actions add up, and that's what fuels our growth in grassroots movements. And we've talked about the power of sharing stories. Now I want to share how we use the stories that so many have shared with us. On your screen here, these are real stories from NPF volunteer advocates who stepped up during our last call to action and showed how Medicaid has impacted their lives and communities. Every voice matters, and we took these stories and shared them directly with policymakers. Because when decision makers hear from real people affected by their decision, it matters. They're putting a human side to an issue and focus on real solutions. So as you read these stories, think about what that makes you feel, what the ripple effect is, and how this can grow awareness, grow understanding, and even lead to changes. Now, I know I've covered a lot today, but what I really want to know is I want to hear from all of you if you have any questions or thoughts on what I've covered, or even any broader discussions or questions. Or if you have questions in your chat, and I just realized I had my chat closed out, so let me go ahead and open that up.
Thank you so much, Anita, and I'm happy to help field some of the questions that popped up in the chat. I think there are a lot of people who are starting to share what Medicaid is called in their state. And I think a lot of people also brought up how managed care has a role in implementing Medicaid. So there is a question I think I have here, and let me see here, Vera.
That's to put up the QR code, so the QR code is back up.
Yes, thank you for that. We can leave that up Now, some questions here. I think I see this from Vera. Would be nice to hear on the Medicare buy-in options. Can we maybe get a separate seminar webinar on this? And I think that is focused on Medicare, and we can definitely think of something like that down the line for sure, because you're absolutely right, Vera. That is that deserves a whole other hour to talking about that.
Melissa, I'll jump in to say that the Patient
Absolutely.
Advocate Foundation, it's Rebecca Kirch, on the team here. Patient Advocate Foundation does have a wealth of Medicare specific resources on its website. They have a whole resource directory specifically dedicated to Medicare as well, just as a quick reference point for people to know about in terms of that question. And
Absolutely.
Don Kreese weighed in. I'd love to hear from him. He's a colleague of mine on the ICER panel
Oh,
in New
sure.
England. So, Don, if you're available to come on camera and talk a little bit about the points you make about Medicaid being important for everyone, whether or not you're relying on it for your children, it would be great to hear your perspective.
Sure. Here, I'll take my hat off so
Hi
you can see
there.
what I
Good
look
to
like.
see you. We're glad you're here.
Yes, thank you for having me. I didn't really intend to insert myself into the panel necessarily, but I guess in the cystic fibrosis community, we enjoy tremendous solidarity. And so I think CF families understand that even if you are not personally, you or your loved one is not personally participating in the Medicaid program, we all have a stake in making sure that Medicaid pays adequate amounts to our providers because the providers, at least in the CF space, aren't discriminating amongst people on or off Medicaid. They're delivering the same quality of care to everybody. So that quality becomes inadequate when the Medicaid program is not providing adequate compensation. I think I personally roll that out front and center as my argument for why everybody should care about this, even if you think you're never going to need Medicaid yourself.
I appreciate that, Don, and thank you, Rebecca, for flagging his comment. We could not agree more, and I really appreciate your perspective being added today, and absolutely right. Thank you. Um, I see there's also Christy, I think you have a comment in the chat and was wondering if you wouldn't mind also just maybe sharing a little bit more of your perspective as well. Christy Claviter?
Hi there. Sorry about that. I was reviewing stuff in the chat and I'm like, okay, I hear my name. So my question is that um I'm deeply involved in so many parts of Medicaid. It's not just the basic healthcare coverage. Because I have the healthcare coverage, the Medicaid coverage, I'm also eligible and requiring subsequent programs, like, for example, the Home and Community-Based Services Program, which provides, here it's also called the waiver program in Michigan, but that actually provides home care for me for a live-in caregiver to get paid. And so part of my question is when we're talking about Medicare, how deep are these cuts going? Do we know? Because a lot of this stuff is obviously kind of kind of being done on the whim of someone who truly doesn't know how these services truly help people and how deeply they go. Is there any insight or any indication as to what they're looking to cut, or are they just looking to cut Medicaid and anything that goes with it right now?
Great question, Christine. Rebecca, I see you came off mute. Please jump
I'll
in.
try I'll try to answer, and it's a darn good question with a difficult answer because a bit of these are times that have become very polarizing around health insurance, the types of coverage, who should be have it available. So the budget discussions happening in Washington, D.C. are fraught with discussions about where are we going to find cuts. They're not saying it's going to be Medicaid, but the dollar amounts that they're talking about that need to be cut to enact tax changes would require cuts to programs like Medicaid. And so the natural assumption being made is we need to protect those essential programs that help people remain whole in healthcare. The dollar amounts they're talking about for cutting across the budget are $880 billion over a number of years. So the reason the entire patient advocacy community at large gathered to do a Medicaid action alert and say no cuts is it's a critical part. I've seen the nuanced messaging around this is an earned benefit, and indeed it is an earned benefit that people need. We don't know the extent of the cuts and whether or not they're even certainly in town halls. Right now, congressional members are back home for recess. And to the extent they're opening their doors to hear from constituents at all, they're getting an earful about the importance of this program. And that's really why we're asking you all to use the QR code and weigh in with a short video vignette or a statement for yourself, because we have a hotline directly to the congressional offices that care to just reinforce from many patients, many professionals in many communities that are saying in chorus, you must not mess with this system. In fact, of course, our argument is to expand the coverage to help make sure that people have access. So that was a long answer without really a concrete answer. And I wish I could know more, but we're all sort of learning as we go. The stakes are high. Patient voices are the highest level, effective, influential change maker. And so that's why this step to bring all of you together, both to show us all together that there are many of us saying cuts can't happen, but then getting those specific details about what you've seen, what you know, like Don weighed in to tell us. That's critically important right now to keep that steady drumbeat of same message that this is an earned benefit that people need in my community, and here's why.
Rebecca, thank you. Oh, jump in, Anita.
Sorry.
Go ahead.
I actually just want to jump in. I'm reading through the comments, and there's one from Nicole Davis, and this is actually happens to me all the time on when people push back in conversations about Medicaid being the correct option. She asked them, then what's the alternative right now if this program goes away? Not just three, but one. And I can't tell you how many times I've had the very same conversation, or whether it be Medicaid or even TRICARE, we're military, TRICARE family, when I've explained that Adrian's story and they're flabbergasted, said, well, you're military. That follows the same guidelines as Medicare. The same, everything is the same as Medicare. And to your point, Nicole, I asked them, I said, well, if you remove this program or even take funding on this very necessary program, what is the alternative? There isn't. So you're absolutely right in bringing that up, Nicole. Thank you.
And I'll call out too, thank you, Anita. Lisa Hamlet wrote about, what if you had a horrible experience with Medicaid? That too, unfortunately, is going to be the case in any aspect of healthcare. I've been a caregiver for my husband, who sadly died a year and a half ago now, which is still hard to believe when I think about it. It's been that long, but it seems like yesterday. We had very high level coverage and horrific experiences with the healthcare system. So Medicaid too is not perfect in terms of how coverage happens. It depends a little bit. The burden of enrolling and re-enrolling is one way that it can be a horrible experience, or the healthcare that you receive in any case, no matter your coverage, can unfortunately also be a difficult experience. And I think in both cases, that's where advocacy is so important, because one of the fundamental cores of what NPAF, National Patient Advocate Foundation, is focused on is making sure that we bring patient and caregiver voices right up front and center, and those perspectives and those real world stories about how can we make things better. Often they can hinge on where things went horribly wrong, but we can also bring the stories of where it went right. We need all those stories, including the horrible experiences, because I and others try to translate all of that feedback into policy solutions and levers for change. So it's always unfortunate, if not horrific, that difficult experiences happen. And it's our job collectively to capture what you all can tell us about what the experience is, when it works really well, and what about it doesn't, so that we can translate that into policy change. And being heard and understood is sort of the fundamental metric that we feel very strongly every patient, every caregiver, whether family member or care provider, feeling heard and understood is sort of a critical part. And what are the steps that get us there? That's a real focus, I think, for all of us in terms of making this change happen.
Rebecca, we have a question from Dawn, who asks about what we know about the Medicaid work requirements. Did you?
So, yeah.
Okay. Oh, sorry, Rebecca, you ended up on mute.
Work requirements are something that we as a community, an advocacy community, and we at NPAF strenuously oppose, because it's a false setup, kind of like saying people are, Anita highlighted this in her slides, that most people are either working but can't afford or not offered employer-sponsored coverage, or they are working to care for a loved one who cannot work, and saving the health system money because they are devoting themselves to the caregiving of a patient. So in the states, when work requirements are trying to restrict eligibility and enrollment, we weigh in with many patient advocacy organizations always to point to the data that show this is a burdensome, not money saving policy option that makes no sense and doesn't do any of the core goals that might be political rhetoric around misuse, fraud, abuse. So our position is always to oppose those types of proposals and point to data in the states where it was tried, tested, and failed miserably in terms of achieving objectives. If there's anybody else who's had experience with waivers, and especially work requirement advocacy, do raise your hand and speak up about your experiences.
I see Penelope just added a comment in the chat, and Penelope, I want to invite you to share that here with the group, if you wouldn't mind, because it sounds like, as you put in the chat, that Medicaid was such a source of help for you all. I think Penelope may not be in a position to come off mute, but I just I'll add that.
I got it. No, can you?
Oh, there you are. Is it Penelope? Is that you?
Yes.
Yes. Thank you.
Yeah. So in I want to say 2000, my numbers may not add up, but my husband was diagnosed with dementia, Alzheimer's, in 2015, and I tried to manage. I was a manager in a healthcare facility, and I tried to manage caring for him and working at the same time, which was close to impossible. And so I met with people on the alternatives, and I retired early to take care of him. And I didn't know anything about Medicaid, but I was hooked up with a lawyer that had expertise in that area. And we signed up, and it was just a godsend. They gave me a caregiver 15 hours a week so I could grocery shop, and because he was 24 hours a day. And then he reached a point where I just couldn't care for him anymore. He was falling and wandering, and Medicaid helped me facilitate a transfer to a nursing home, and then all his care in the nursing home. They were so supportive. I can't say enough. And now I could have gone on and on in my typing, but my great grandson has cerebral palsy. And so my granddaughter relies on the programs a lot. And then my son and his wife in Minnesota adopted two brothers that at a very young age, a year and a half and 2.5, whose mother had used drugs. And so they have some developmental problems. And I'm happy to say they're 6 and 7, and they're doing wonderful, but they continue to use the programs for rehab. They have occupational therapy, all sorts of things that they go through. And it's with Medicaid and the children's programs that my grandchildren are benefiting. So I think it would just be tragic if it went away. And I live in a small town now. My kids wanted me close to them. And this town, I don't know if they even have programs to educate people, but when I get off this, I'm going to call the insurance guy that I go to and see if there's some way he can hold educational things at the library so people can see how important this really is.
Thank you so much for sharing your story, Penelope, and what essentially you're going to do after this webinar to hopefully educate your communities. I think connecting at libraries using the information that we provided here is a really great start. And again, thank you so much for sharing that, Penelope. And I hope I didn't put you too much in the spot, but I think what you shared in the chat was really, really helpful.
You.
Of course, of course. And my team, I'll call on you to see if you see any other questions popping up in the chat. Others may be welcome to, raise your hand and come off mute if you want to contribute to this larger conversation.
I am seeing just a couple comments here and there that I'll respond to while others may be thinking about what they might want to contribute. In terms of challenges that folks may experience, many of you on this call are certified patient advocates, and we thank you so much for what you do. And the more you learn about these programs, as I've seen in the comments, how critical that is for patient navigators, needs navigators, financial navigators, patient advocates all across the board. At Patient Advocate Foundation, there's the ability to help patients who are experiencing different challenges. And Anita is best first to talk about the case management program, so I can turn it to her a little bit. But one of the resources that Patient Advocate Foundation offers is the ability to call when you have a financial or social struggle and speak to a person by phone who can help walk you through what your needs may be. And I just wanted to share that with this community. Our capacity is limited to be able to meet the demand of where patients and family members are experiencing challenges, but it is one resource that is available to people, not specific to Medicaid, but to many types of distressing circumstances that are happening in our world now, and as coverage shifts and as complexities happen. But Anita, did you want to add to what I just said? Because you are the well-versed expert in talking about the case management program.
Sure, thank you. I just shared in the chat, PAF actually has online a national resource directory as well. That's easy to access. You can narrow it down based on diagnosis, your state, and what type of resources you're looking for. And yes, patient advocate foundations, case managers, just to get one, you have to have a cancer, chronic, or life debilitating disease. But what I love about the resources, or even all the education resources on the website, it could be used broadly for anyone. I've used the own resources on how to do an insurance appeal for my own insurance. So I encourage you all to look at I'll share the link to the main website as well as the educational resources. I have the financial directory resource in the link as well.
And we do have a hand raised from Nicole. Nicole, you're welcome to jump in.
Hey, sorry. I did not know that my hand was raised, but I guess it was fate. I just wanted to thank the MPAF team for putting together this amazing platform and a forum to have a very crucial, very critical conversation that touches all of our lives, the work that we do. This is huge, so I just want to say thank you for that. And to I guess the last thing in the comments that we were kind of going back and forth for supporting was just the overall notion that for Medicaid, for any other policy conversation, please, please, please try to do the best that you can to educate yourself about what's going on from your own lens. I think that platforms like news outlets and everything like that are great, but if you do have the capacity and the resources and the time to really dig into things from a nonpartisan view and form your own opinions, it allows you to be a little bit more complex and a little bit more, I think, maybe understanding or equitable, I guess, in the way that you think about other people's views of these conversations. So I've learned a lot from doing that. It's allowed me to listen to perspectives on both sides of the aisle, see merit in some, see completely differing views in others, but it just makes you, I think, a better learner. We're not saying that these programs are perfect. We're not saying that they can't be improved, but the overall kind of ethos, I think, of this call is that the work that's currently being done is so impactful and so important, and it needs to be protected, especially if there isn't that better alternative isn't ready-made for us packaged right now. So I won't monopolize the mic. Thank you all for this opportunity, and thanks for the time.
Thank you, Nicole. I think you said that so well, and just appreciate you doing what you are doing on the ground and helping to inspire others. I think Jennifer asked if for some templated social posts to use on platforms. Yes, we will have those, and we will send that to you all so you can share on your platforms, but also please follow, engage, and share the posts that we do too. So, and make sure, you tag us so we can, it's a full circle. We will all be doing it. So yes. Let's see. Are there any other questions that folks have? We have about 15 minutes left allocated. And you're welcome to raise your hand if there's anyone that has seen something particularly resonating in the chat. You are welcome to come off mute and lift that up.
Hi there, this is Jana.
Hi, Jana. Go ahead.
Hi there. I left a chat there also. I'm in Massachusetts. Fabulous healthcare. I am a ombudsman here in Massachusetts. So I visit the residents at senior facilities, skilled nursing facilities, and I've seen really younger folks that are in those facilities as well as, older and senior citizens. And really, what I always push for is just, obviously the advocacy part. I'm not the bad guy when I come in. I'm the person that's there to listen for both sides. And really just to get more representation from the state there, from, the social workers. Here we call them shine workers, being able to get all the information that those residents and families need and deserve and are supposed to be having. A lot of them don't know. I mean, it could be as easy as a wish that they want for the menu. And I don't always want to have tacos. They want pizza. Something that simple to something very, very serious where they're really having a problem with a person that they're sharing a room with. That that it could be volatile. It could be very dangerous. So just to be able to have that person and regularly have folks there at those facilities or the COAs, really just to have a sounding board and really what their needs are and what possibly the state could do for them also.
Thank you for that, Jan. I think that's a really, really great point to elevate. Thank you. And I see another question here from Deborah, who touches on do we advocate for other legislation like Help Co-Pays Act, research funding, etc. And I think what we can share, and I think Rebecca, I may have you jump in. Our priority now has been really, really protecting Medicaid, but we know that there are so many other parts to what's currently going on in this healthcare ecosystem that are just under threat. So Rebecca, if you're in a position to share a little bit more from that perspective.
Sure. So our priorities for policy change range across regulatory reform as well as legislative reform, but also practice change in health systems without requiring a legislative or regulatory fix. So it's broad in terms of the levers that we might use, but National Patient Advocate Foundation's mission is making the healthcare system work for all of us. And that means that equitable access, affordable access, quality care are sort of the pillars of everything we look at in terms of where we will support legislative initiatives or oppose them. And of course, research funding is a critical part of the healthcare system because it guides the improvement of quality care. So yes, we do advocate for, and right now, of course, the National Institutes of Health, with its reductions in force and other changes to research grants, is in a threatened position, as well as public health through the CDC. So there are many different areas of activity right now, right, where I don't mean to be dismissive by saying it this way, but we're experiencing an unprecedented whack-a-mole of different threats to the healthcare system as it now exists and the safety net within it. So the priorities that we have cover medical care, mental health care, and financial well-being, all wrapped up together because that's how people experience illness. Their medical, mental, and financial health all are wound up together in the illness experience. And so the policies that we prioritize and try to advance and innovate around really focus on that holistic view of people and the caregivers who support them. So our policy agenda is broad in that sense, based on what people tell us matters most to them, and is very person-centered instead of thinking about the bottom line as the industry may do. We really use the voices of all of you and those perspectives of people, especially in the rural areas, in under-resourced areas, because that's the catchment of patients that are served by our sister organization, Patient Advocate Foundation. So our goal is to really bring those voices to the forefront of reform so that we make real change happen on the ground through all different opportunities that we have to influence policy. And the voices of all of you and the stories you share, when we collect them together and carry them forward into the rooms where changes get made, it makes a huge difference in terms of the change that can be affected.
Thank you for Rebecca for providing that backdrop to just all the things that we are seeing and what our capacity from where we sit here within the larger just what's happening in the country and what we can do and what we can focus on. And so I think that perspective is helpful. I know we have a couple more minutes, and I think the chat is still lively with people sort of exchanging information and sharing resources. Anita, I think what we can do is come back to the slides. Thank you. We do have a short survey that we'd love for you to just share your feedback, and I will drop that link in the chat so you all have a chance to provide us feedback. And we will also circulate, I mentioned this in the chat, but we will go through the chat, lift up any of the links and resources that were shared. We will also share the links and resources to the different websites and organizations who are doing important work on Medicaid. And so we'll make sure that you have access to that. We'll share the recording as well once that's all uploaded. But know that you all can continue to reach out to us with any questions you have. This is the first of likely many trainings. I know we brought it back to the basics here, but sometimes it's just a helpful refresher. And I think just even providing you all with some inspiration about how you can have these conversations in your own communities is really helpful, and it's a very important way for everyone to start really understanding and caring about Medicaid. So with the couple minutes that we have, we're going to leave the slide with the QR code because I think as we were on this call, we started to see many people actually fill out that form and share their stories. And so we will put that back up and just leave you with some of the immediate things that you can do, but know that we are going to follow up with an email with all of the resources that will help you. So we'll stay on for just a couple more minutes, but I just want to extend my gratitude to my team, Anita especially, for putting these slides together, really inspiring this discussion. We know it was just the basics, and we can always come back and do a deeper dive on some of the other topics. I think I saw Francis mention that it's not just Medicaid, it's SNAP, it's other safety net programs, and yes, absolutely right. It is not just Medicaid. So I think with that, we will close it out, but want to just extend our gratitude to everybody here and for being part of this conversation. We'll stay on just a couple more minutes so people can grab the QR code and the link to the evaluation. Thank you all.